Around the world, countries are beginning to ease lockdown measures. Economies are slowly reopening. Students are going back to school. But the World Health Organization has issued a telling statistic. In the first 2 months of the Covid-19 pandemic, 85,000 cases were reported. But in the 2 months from mid-April to mid-June, the figure was about 6 million. And on June 21st, the WHO reported another grim milestone.
More than 183,000 new cases of COVID were reported to WHO. Easily the most in a single day so far.
More than 9 million people around the world have now been infected. With global cases hitting new records, scientists and health experts are reluctant to predict the course of the pandemic. Will things get better or much worse before this is all over? Scientists say that outbreaks of the coronavirus that causes COVID-19 can vary greatly depending on how governments and people respond. Many countries have been under lockdown for months, with strict social distancing rules and stay-at-home orders. And for the most part, that has worked. In former virus hotspots such as Spain, Italy, and China, such drastic actions have significantly improved the situation. But they also take a toll on the global economy. Millions of people have lost their jobs. In some cities, frustration has turned into angry protests.
Open Ohio now!
And in some developing countries, the lockdowns have led to food shortages, which also sparked violent demonstrations. But in other areas where case numbers have declined, life is slowly getting back on track. Some European countries have lifted their lockdowns and reopened their borders to travelers from within the continent. But some health experts warn that restarting economies prematurely could lead to a rise in COVID-19 cases. South Africa reported a record single-day rise in new cases on June 20th, when nearly 5,000 infections were found. Despite that, the country is moving ahead to further relax lockdown rules, allowing casinos, beauty salons, and sit-down restaurant services to reopen. And in China, a new outbreak of COVID-19 hit the capital Beijing, just a few weeks after the easing of quarantine rules and domestic travel restrictions. More than 170 people have tested positive so far, and authorities have reinstated many lockdown measures. Some are banking on a concept known as herd immunity to stall the transmission of the coronavirus. The term refers to the point where about 2/3 of the population have either been exposed to a virus and have protective antibodies or have received vaccinations. In that case, even those who don't have immunity are much less likely to encounter infectious people. But there are problems with this strategy. Although scientists are working on a number of vaccines, it could be years before one is approved and rolled out. And even the hardest hit populations are nowhere near to seeing the threshold of 60 to 70% infections needed for herd immunity to kick in. Antibody testing indicates that only as much as 5% of the population has been infected, a relatively small percentage that has already caused immeasurable suffering and death. This leaves many governments around the world facing tough decisions. Can they restart their economies and give people a sense of normalcy while keeping COVID-19 cases down? The WHO warns that in some areas, the worst is yet to come. The UN agency's regional director for Africa pointed out that it took nearly 100 days to reach 100,000 cases on the continent, but it took just 19 days to double that. And in Brazil, coronavirus-related deaths have surpassed 50,000, with more than 1 million people infected. Despite the numbers, Brazil's president continues to downplay the risks of COVID-19, saying the economic impact of the lockdowns could be much worse than the disease. With outbreaks peaking at different times in different countries, the risk of the coronavirus ping-ponging back and forth is very real. And new clusters in South Korea and China show that the threat of new outbreaks emerging at any time could remain for the foreseeable future. Health experts say there's only one thing everyone can do:
The world is in a new and dangerous phase, but the virus is still spreading fast. It is still deadly, and most people are still susceptible. We call on all countries and all people to exercise extreme vigilance.